All right. Good afternoon, employees of Gen 3. My name is Allie Tom, and I am your guys' insurance broker. So if you guys ever have any questions or concerns about the health insurance throughout the year, I am your point of contact. I know this says Colorado employees only on this page, but this is a good overview for all of the employees at Gen3 Construction. Out-of-state employees, you guys will get a slightly different packet. The only difference is there's one plan option that's available to Colorado employees, that's not available to out-of-state employees. These benefits begin August 1st and go through July 31st of next year. Not a lot of changes. We're going to be sticking with United Healthcare, the Gap Insurance and Guardian. So again, my name's Allie. Here's my contact number right here, my email address. I'm a good point of contact if you guys have any issues with the health insurance, have claims questions, that sort of thing. Daniela is also a good person to reach out to over there, and her information is listed on here as well. Again, we're staying with United Healthcare for the medical. We've got Morgan White Group for the gap insurance, and then we are going to stick with Guardian for the dental, vision, life, and accident insurance. So this is just some legal jargon that you guys can read on your own time. Very similar. There's a cost sheet for you guys going over everything. There's not going to be any changes in your cost this year. So that's the good news. No changes in cost at all. So this first plan with United is the Doctors Network. This is for in-state Colorado employees only. So if you live outside of Colorado, unfortunately, this plan will not be offered to you. But we're going to go over it really quickly anyway, so I apologize to the out-of-state employees. So on the left-hand side, this is how the United Healthcare Doctors Plan runs on its own. And on the right here, this is how it runs with the gap insurance coverage in place. So we're going to go over this right-hand column right here because this is how it's going to really feel. So just as a reminder, we've implemented gap insurance. The gap insurance pays your guys' out-of-pocket that you have with United Healthcare after you've reached $2,000. So we'll go over that here. So primary care is a $0 copay. Seeing a specialist is a $125 copay. Preventative care is always going to be covered at 100%, so $0 cost to you guys. So always make sure each year you're going in for your preventative visit. Prescriptions are broken out in tiers. So tier 1, 2, 3, and 4. Tier 1 is going to be generic medications. That's a $15 copay. $55 for generic brand name. $135 for brand name medications, and $350 for specialty medications. Mail order. So if you guys ever want to order it in the mail, you get a 90-day supply. So you'll see there is a little bit of a savings if you do a 90-day supply because that's 3 months worth. Those costs are broken out in the same tiers. Urgent care is $0. Telemedicine is $0. And then these big things like the emergency room, ambulance, inpatient hospitalization, outpatient treatments like a surgery, diagnostic labs and x-rays, MRIs, CAT scans, those sorts of things, those are going to be covered 100% after you reached your $2,000 gap deductible. So after you've paid the first $2,000 of your United deductible, the gap is going to pay the remaining cost after that. Outpatient is $0, and outpatient therapies like physical therapy and occupational therapy is $125 copay. So how the plan works, you'll see on the left here, this is how the plan would work with United Healthcare without the gap insurance. So you'll see that you guys have a $9,100 maximum out of pocket. What the gap insurance says is, hey, you pay the first $2,000 of that, and we're going to reimburse the providers the remaining $7,100 of your United deductible and max out of pocket. The only things that the gap insurance does not provide reimbursements for is the co-pays for doctor's visits and prescriptions. So you'll see here, if you have a specialist copay of $125, the gap wouldn't reimburse you for that. And these co-pays for prescriptions, the gap wouldn't reimburse you for that. But everything else, the gap will reimburse you after you reach that $2,000, or they'll reimburse their provider. Typically, the gap insurance pays the provider if the provider files the claim. You'll see that if you have family on the plan, that your family max out of pocket on this plan is $18,200. We're able to bring that down to $4,000. So the reason why we do the gap insurance is there's a big cost savings. If we were to bring you guys a $2,000 plan with United Healthcare, $2,000 max out of pocket plan with United Healthcare, it would be thousands and thousands of dollars for you guys to have that plan. It'd be really expensive in premium. And you guys, so what we've done is we're able to bring down the premiums and then protect you guys financially from catastrophic claims. So instead of having a 9,100 max out of pocket, you're looking at $2,000. So the next plan that we're going to go over, this is for every single employee, whether you live in Colorado or you live out of state. This is the United Choice Network. This is going to be the biggest network that United has to offer. It's the nation's largest network. This doctor's network, it is a narrower network. So if you're living in, you have to live within a Denver County, Jefferson County, Weld County, Arapahoe County, Adams County. You have to live within like a 30-mile radius of Denver to be able to be in this network. That shouldn't be an issue for most of you Colorado employees, but just a reminder. So this is a more narrow network. The Choice Network, this is available nationwide and it's their biggest network. Virtually almost every single hospital and doctor where you guys are living right now is going to be in the Choice Network. I do want to note right now that we're getting rid of the Choice Plus network. There are a handful of you guys that are enrolled on the Choice Plus network, but I just want you to know that the United Choice Network is the same exact network as the Choice Plus. The only difference is the Choice Plus had out-of-network benefits. But what I know from looking at the claims data for you guys is that not a single one of you guys went and saw an out-of-network doctor, hospital, provider, that sort of thing. So we decided to get rid of the Choice Plus. So if you guys were currently enrolled on the Choice Plus, you're going to want to enroll on the Choice Network. It's the same network. So again, how the health plan with United works is on the left, and how it works and operates is on the right with the gap insurance. So you guys have a $25 copay for primary care, $75 copay for specialists, $0 copay for preventative care. Again, the generics $10, generic brand name medications $35, brand name medications $75, and specialty medications are up to $250. Urgent care is going to be $50. Telemedicine is going to be $0. And everything else like the emergency room, ambulance, inpatient, and outpatient, diagnostic labs, x-rays, those sorts of things, those are going to be covered at 100% after you reach your $2,000 gap deductible. Outpatient mental health and outpatient therapies like physical therapy and occupational therapy is $75. So again, you'll see right here that on the United plan, you guys have an individual out-of-pocket max of $8,000. We're able to bring that down to $2,000. With the family, it's $16,000. We're able to bring that down to $4,000. Again, with the exception of copays for doctor's visits and prescriptions. So, if you guys are on the plan, just know that, every time you have a copay for any of these things, that those will not be reimbursed by the gap insurance. But everything else on the plan, if you have a surgery, if you are inpatient at a hospital somewhere, if you have a baby, everything's going to be covered after that $2,000 for individual or $4,000 for the family deductible. So like I mentioned, what are the changes this year? So, it's been really great that we've been able to keep the health insurance secure with United Healthcare. That gives you guys a lot of stability. I really like that we're able to keep that with United Healthcare. That means, you guys can keep all your same doctors and that sort of thing. But like I said, we're going to be removing the United Choice Plus plan. So if you're currently enrolled on that plan, you're going to have to enroll on the Choice plan. And again, they're the exact same networks, so no one's going to experience any issues with their current medical providers. You'll all still be able to go see your same doctor, go to the same hospital, go to the same provider. The only difference is that there's no out-of-network benefits. And that sometimes can scare people, but none of you guys are going out of network. It's really hard to go out of network. This is United's nation's largest network. Let's say you're traveling and you get in an emergency situation and you go out of network. All life-threatening emergencies are always going to be covered on the health insurance as if they're in network. So I don't want you guys to worry. They're the exact same networks. But if you want to double check and make sure your provider is in either the doctor's network or the Choice Network, I've provided you guys with instructions on how to do that. So again, no changes in the network between the Choice and Choice Plus. The only difference is that you guys don't have out-of-network benefits. Based on the claims data, I did see that not a single one of you guys was going to an out-of-network provider, so you'll see no disruption to care. To search to see if your doctor is in network, if you haven't, found a provider yet, or you want to see the difference between the doctors and the choice network, these are instructions on how to find an in-network doctor for you. So how the gap insurance works, let's go over this. I've got some examples here. So let's say you injure yourself skiing and you need to have surgery on your knee. Your total cost with MRI, surgery, and specialist visits is $15,000. So you'll pay the first $2,000 worth of medical claims. The gap will then pay the remaining $6,000 of your United deductible. With your $2,000 of costs and the gap's benefit of $6,000, you have satisfied your deductible of $8,000. And your remaining claims over $8,000, United will pay in full. Couple more examples. You're on the choice copay plan and you break your arm. You need to go to urgent care and they give you a cast for your arm and prescribe you with pain medicine. The total cost of your visit is $3,000 and the pain medication is a $10 copay at your pharmacy. You will pay the first $10,000 of your urgent care claim. The gap will then pay the remaining $1,000. You will pay the $10 copay of your pain medication. If you have any more medical claims throughout the year, the gap insurance will pay for these since you have met your $2,000 gap deductible. The only thing the gap will not pay for is copays for office visits and prescriptions. If you have more claims that exceed $8,000, United covers those at 100%. Another example, so let's say you're on the choice copay plan with your spouse and she has a baby. The cost of delivery is $13,000. Your wife meets her United maximum out of pocket of $8,000 and the baby meets $4,000 of their United deductible. As a family, you have a $4,000 gap deductible to meet before the gap starts reimbursing providers for claims. So you would pay the first $4,000 of claims, $2,000 for your spouse and $2,000 for your new child. The gap will then pay the remaining $9,000 of your family deductible. With you paying $4,000 and the gap paying $9,000, you have met the $13,000 of your $16,000 United family deductible. If your spouse has any more claims for the year, United will pay 100% of the claims. If your child has any more claims for the year, the gap will pay 100% of the claims until the remaining max out of pocket with United is met. The only thing the gap will not pay for is copays for office visits and prescriptions for the baby. So the gap is called the premium saver. So again, this is a two-card system. So you're going to have an ID card with United Healthcare and you're going to have an ID card for your gap insurance. So you're going to present both ID cards every time you go in and see a doctor, provider, hospital, that sort of thing. The provider is going to verify coverages with both insurance carriers. So they send off claims to both United and then they'll send off claims over to the gap insurance. If they ever have any questions on how to file claims or they're not sure what the gap insurance is, there is a provider phone number they can call and they'll be able to get talked through the claims process. But basically the provider will file the claim. Once the claim has been approved, the gap insurance pays the provider directly for any cost after your $2,000 deductible. If you've made any payments, if you've paid out of pocket for claims this past year, and you're not sure the gap insurance paid, that sort of thing, reach out to me and I'll make sure that, we get you guys reimbursed for any claims that you might have had because, don't forget that this gap insurance is here to pay for medical claims for you guys. So if you've had more than $2,000 in claims this past year, you're likely due for some reimbursement from the gap insurance. So another thing I want to go over is telemedicine, urgent care, and emergency, when to go and where to go. So a lot of employees, so I get a claims data sent to me by United. It doesn't include any of your names. You guys are all protected under HIPAA, but it does show me the amount of people that went to urgent care, the amount of people that went to emergency room, amount of people that went to urgent care, and how many people use telemedicine. There were a lot of people that went to the emergency room this year, and that's really expensive for you guys. So what I would always recommend is that, first stop shop, telemedicine. The telemedicine is going to be $0 for you guys to use. And you can Skype with a doctor using the Healthiest You app. It's a free visit with a doctor. So if you guys aren't feeling well, you have a rash, diarrhea, allergies, flu, that sort of thing, you can use telemedicine and Skype with a doctor at no cost. The next step is when to go to urgent care. So urgent care can assist you with really serious injuries and illnesses. You know, if you have a fracture or broken bone, if you need to get stitches, if you're bleeding, if you sprained something, if you got burned, cut, that sort of thing, if you have really severe flu symptoms, that's when you go to urgent care. Urgent care is either going to be a $0 copay if you're on the doctor's plan, or a $50 copay if you're on the choice plan. So there's a big cost savings there, because when you go to the emergency room, you guys are paying out of pocket up to that $2,000 gap deductible. So you know, the difference between $50 and $2,000, that's a lot of money. So you really want to make sure you're going to the emergency room for true life-threatening emergencies. So just remember, next time you need to go to, if you think you need to go to the emergency room, kind of take a pause and say, do I need the emergency room, or do I need to go to urgent care? Big cost savings for you guys going to urgent care. Next, I want to get into, so you guys have really good rewards programs with United. You guys can earn up to $1,000 a year just by tracking, you know, 5,000 steps a day or 15 active minutes each day. Track 14 nights of sleep. If you guys go paperless, so instead of getting mail sent to you direct, like in paper form by United, you could decide to go paperless, and they'll email you stuff, or they'll send you stuff on your member portal with United. If you get a biometric screening done, take a health survey and connect a fitness tracker like a Fitbit or an iWatch, an Apple Watch, those sorts of thing, a Garmin. Those will all help you earn up to $1,000 this next year. How you can track that and how you get started is downloading the United Healthcare app, or go to myuhc.com. You can also use this QR code to scan that. And if you guys haven't already set a member account with United, I recommend you do so. This is going to help you track your rewards, but also there's so much on the app that you guys can use. This has access to your ID card 24/7. You can track claims and your deductible and that sort of thing on the app and online. So telemedicine, like I said, this is free for you guys to use. This is through Healthiest You. So you would download the Healthiest You app. It's separate from the United app. But this is the free telephonic counseling. So if you need therapy sessions, they have this. If you're sick, you can Skype with a doctor. They have dermatology on there. So they have all sorts of stuff on the Healthiest You app. But a good first stop for you guys to go if you're not feeling well. So this is, again, connect to your plan. So make sure that you guys are going to MyUHC to register if you haven't already done a member portal. You can download the app too. Again, you can find nearby care options. So if you need to find a doctor or a place to go, you can do that. You can see your claims details and view the progress towards your deductible. Just as a reminder, your gap deductible will not show on your United portal. These are two separate insurance companies. So you do have a gap portal that you can log in as well. View and share your health plan ID with your doctors, video chat with a doctor. So on-demand urgent care. So this is going to cost the same as your guys' urgent care. So if you're on the doctor's plan, it's a $0 cost for you to use this service. If you're on the choice plan, it's a $50 cost to use this. And this is urgent care on wheels. So it's Dispatch Health. They'll come to you. So, you know, again, if you've got some common ailments, fever, cough, cold, flu, urinary tract infection, eye infections, skin rashes and infections, respiratory issues, if you get hurt, break a bone, you need stitches, they'll come to you. It's about a 2 to 4 hour wait, depending on how busy they are. But yeah, again, this is a really great way for you guys to save money. Let's say you've got some sick kids at home and you don't want to lug them all over to urgent care. They'll come to you. So it's a really affordable way to get treated, and they'll come directly to wherever you're at. GoodRx. So there's some good ways for you guys to save on your prescription medications. So if you haven't used GoodRx before, basically you go to goodrx.com, or you can download the app. You put in your prescription that you're taking and your zip code, and it will show you 10 results of where to go get where is the most affordable place to pick up your prescription. So even if you're on a generic medication and your copay is $10 a month right now, most generics on GoodRx are going to be under $10. So there's a lot of good cost savings on here. Even if you're on a brand name medication, there might be some savings on here for you guys. Just a reminder, if you do use GoodRx, it's not applied to your United deductible, just because you're not using the United insurance. Instead, you're using a GoodRx coupon. So just something to keep in mind, but good savings right here if you guys shop out your prescriptions. United also has the Real Appeal. So this is a lifestyle and weight management program. So if any of you guys were wanting to manage your weight, lose some weight, pick up some healthier habits. So it's a really great program that they have. So they send you a success kit at no cost, which sends you a weight scale for you and a weight scale for your food. There's a digital fitness app that comes with free classes. There's like free yoga classes, free weightlifting classes, free Peloton classes, that sort of thing. You get a personal health coach to support you. And there's also online support. So customizable food activity, weight and goal trackers, unlimited access to digital content. You can chat with other people. So this is a really great program, and this is free for you guys to use. Even if you're not trying to lose any weight and you just like to work out, the free classes on here are awesome. We've had really good feedback from clients that have used this. So Healthiest You, again, this is your guys' telemedicine. What they have is they have mental health on here. So it's called My Strength. This is free telephonic counseling for you guys. So if you want to start your journey, if you want to work on your mental health, this is a free service for you guys to use. Really awesome service that United has. All right, and then next we have the Guardian benefits. So again, nothing has changed with your dental, vision, life insurance, and accident insurance. So nothing's changed with these at all. I want to go over some highlights pretty quickly. So for your dental coverage, I'm going to go to the next page because this is a little bit more helpful. So you guys have an 100 80/50 policy. So what that means is that preventative care, so things like cleanings, fluoride treatments, oral exams, and x-rays, those are going to be covered at 100%. So Guardian pays 100% of that. If you guys have any things like fillings, periosurgery, root canals, like simple extractions and surgical extractions, those are covered at 80%. And then major care is covered at 50%. That's things like anesthesia, bridges and dentures, inlays, onlays, veneers, repair and maintenance of crowns and bridges, single crowns. Those are covered in the 50% category. You guys have a annual maximum benefit of $1,000. That means Guardian pays up to $1,000 in claims for you. What's really cool about Guardian on this next page is you guys have an oral health rewards program. So right now, as I just mentioned, you guys have $1,000 annual maximum. That means Guardian will pay up to the first $1,000 of services you have. What you guys have though is a rollover benefit amount each year. So Guardian says, hey, if you come in at least once a year for a cleaning and you don't utilize more than $500,000 of your $1,000 claim maximum, we will give you an extra $350 next year towards your $1,000 annual max. So if you go in once for a cleaning this year, you don't go over $500 in claims, Guardian next year will give you a maximum amount of $1,350. Let's say in the maximum rollover account limit is 1,000. So if you've been on the plan for a few years now, you've been going in at least once a year for your cleaning, you haven't utilized over $500 in claims each year, you're eligible for up to a $2,000 maximum benefit here in a couple of years, which is really awesome. So let's say you're going on the plan, you've been on the plan 5 years now and you haven't had any major stuff done. And then all of a sudden you're told that you need like a root canal and a cap and a crown and all that stuff put in. Well, Guardian would pay up to $2,000 of that for you, and then you would cover the remaining cost after that. So a really great benefit that they have. Just make sure the way it works is you have to at least go in once a year for a cleaning. They really want to make sure you're doing your end of the bargain by going in for preventative visits. Vision, I need to put in the vision page here. This is the wrong page, and I apologize about that, but I can go off the top of my head of what your vision policy is. You guys have a $10 copay for vision exams. That's really great. So if you're going to an in-network provider, you get a $10 copay for a vision exam. You guys get up to $130 a year to go towards contact lenses, or every 2 years you get $130 to go towards frames. New frames. So if you need new eyeglasses, you have a $130 limit on that. You also get discounts. So you get about a 30 to 40% discount depending on the provider on lenses and frames. So the way I always recommend people, if you're a contact and lens wearer, I would use the yearly benefit of $130 to go towards contact lenses, and then I would use the discount on lens or on frames on eyeglasses if you need them. I'll update this packet so when you get it, the vision coverage is included in there. Life insurance. So for the life insurance, Gen3 pays for a $25,000 basic term life coverage for all full-time employees. So right now, if you were to, have an accidental death, or if you were to pass away unexpectedly, your family would get $25,000. That's a good benefit. It would help pay for, final costs of life and, funeral service and that sort of thing. If you guys wanted to buy more than what Gen3 pays for, you guys can elect up to a maximum amount of $500,000 and you pay for that. It has a guaranteed issue of $100,000. What a guaranteed issue means is that you do not have to go through any underwriting to obtain up to $100,000 of life insurance. If you want anywhere between $101,000 to $500,000 of life insurance, you're going to have to go through some brief underwriting. It's a really easy questionnaire that you have to fill out. It's only like 3 pages long. And then we submit that into Guardian, and they either approve you or deny you. If they deny you, let's say you wanted to elect $200,000, but you had some health issues and they denied you, they would give you $100,000 guaranteed in life insurance. So you'd still have that coverage. Your children and your spouses are also eligible for the plan. Your spouses have a maximum benefit of up to $250,000. Their guaranteed issue is $25,000. So if they wanted anything over $25,000, they'd have to go through the underwriting process. And then your children, you guys can elect up to $10,000 in life insurance for them. So this is the rate chart, kind of goes over like, hey, if I'm an employee and I wanted to elect $200,000 and I am of age 50, so the 200,050, so each month your guys' premiums would be about $43. So per pay period, if you guys are getting paid bi-weekly, divided by 2, you're looking at about $21.50 a paycheck for a $200,000 life policy at the age of 50. This is portable, so if you guys were to leave Gen3, you are allowed to take your voluntary life insurance policy with you. You just have to reach out to Guardian and let them know that you want that benefit if you leave Gen3. So accident insurance. Accident insurance is really great coverage. It's really, really affordable for you guys. It's just a few dollars a month, so like a couple dollars a paycheck to have accident insurance. And basically, accident insurance just pays you a flat amount for all sorts of things. So if you're in a car accident and, an airbag goes off, you get a $15,000 payment right there. If you have any dismemberments, if you lose like a finger or toe, you get a benefit amount for that. If you guys were to take an ambulance, they give you $400. If you're put into a coma, which hopefully never happens because that's pretty severe, you get a $20,000 benefit. Concussions. So if you have any kids playing sports and they're on the plan with you, this would pay out a $300 benefit for them. All sorts of stuff. If you have a hospital admission, they'll pay up to $1,500. If you're in the ICU, they pay up to $3,000. So basically, this is just anything that happens to you. If you get in an accident outside of work, this is an outside of work policy. This will pay you guys a flat benefit amount depending on the accident that you have. You can cover your spouse and children under this plan. This is a great plan, especially if you have active kids that are in sports, because, in sports all the time, kids get hurt so often. You're constantly having to take them to the doctor or hospital for an injury. So, this is a really affordable plan for you guys. And if you ever get in an accident, you just need to file a claim with Guardian, and they will pay you the benefit based on the accident that you have. So you guys have a free EAP program, an employee assistance program. So this is free telephonic counseling with therapists, work-life assistance to help you save money and balance commitments if you're having issues with that, access to legal and financial assistance, including will prep services. So this is available to you and anyone in your home. If you're having a hard time and you need to chat with a therapist, they have free telephonic counseling. If you are going through tax season and you have questions about how to file your taxes correctly, what taxes you need to file, they can help you with that. They also have a free will prep program. So if you have any kids or a wife and you haven't created a will yet, I really recommend you do that. Usually a will prep costs a few $1,000s. This is a free will prep program. So they'll create a will for you guys at no cost. So really recommend doing this, especially, if you've got a wife and kids, it's really important, or a husband and kids, really important that you guys get a will created, just in case, you just never know if you might pass away in an untimely time. So making sure you kind of got your ducks in a row a little bit before that happens. So everyone's going to have to complete a new enrollment form. I know this says Colorado only. The out-of-state employees, you guys are going to get a separate packet that has your election options on there. So just a heads up, again, the cost isn't changing at all this year. Costs are going to stay the same, which is really exciting. Gen3 worked really hard on negotiating with carriers to keep your guys' costs low. So, United originally came out with 11% rate increase. We got it down to 2%. Gen3 said that they would cover the rate increase of 2%. So, they gave you guys a rate pass. So everyone's cost is staying the same this year, which is really good. You need to get this filled out and returned to Daniela in a week from today. Today is July 8th. So I really want to make sure you guys are getting everything sent back to Daniela by July 15th. If you have any questions, again, feel free to reach out to me. My contact information is listed on page 2 of the packet, as is Daniela's. But yeah, so reach out with any questions. Make sure you get those forms filled out. And yeah, let me know if you have any questions. All right. Thanks, everybody. I appreciate it.